All right, so now we're going to talk about pain management in children. First of all, for pain assessment, please never chart that the patient's not able to verbalize pain because they're an infant, because if they can feel pain, we need to have a way to assess it. So we look at behavior in pre-verbal children. Vital signs are elevated in acute pain, but chronic pain, they're so used to that pain that their vital signs go back down to normal. So don't use vital signs as your indicator of whether that child is in pain. We also, with young children, want to assess the child's ability to self-report. We want to know, get the parents' take on, are they able to tell me if they're hurting? Are they able to tell me where they're hurting? There are some developmentally appropriate pain scales. There's NIPS for preemies, there's CRIES for neonates, FLAC for infants and toddlers, and FACES for young children. There are appropriate pain scales for developmentally delayed children and adults, cognitively impaired children and adults. There are so many different scales. You need to find the one that's appropriate to that child. Non-pharmacologic pain management. What can we do to help them without meds or to make the meds more effective? Positioning, teaching breathing and relaxation techniques can really help. We want to help them splint especially if they've had abdominal surgery. Have them put a pillow over that incision when they're moving around, things like that. Ice can be used for inflammatory pain. Warm blankets can help relax them and decrease the pain. Guided imagery, distraction. Some of these we use with adults. For children, also, the presence of a familiar caregiver is really helpful because it decreases anxiety. And for infants, sucrose pacifiers have been shown to decrease pain behaviors. When giving opioid medications to children, we need to observe very carefully for respiratory depression and remember that there are differences in the way they metabolize and excrete those. Opioids tend to be more effective if they're combined with non-opioids. Non-opioid pain meds, antiprostaglandin, acetaminophen can be given. Remember, acetaminophen is hepatotoxic, so keep it away out of their reach so they can't get in and drink it or eat all the tablets because they taste good. NSAIDs like ibuprofen are effective for inflammatory pain. We avoid aspirin in children with viral illnesses because of the risk of Reye's syndrome. There are some other meds that help with pain in different ways. Steroids can reduce inflammation, and that can reduce pain a lot of times. Antidepressants and anticonvulsants have been used for neurogenic pain, and they can be used as pain adjunct. Sedatives, anti-anxiety, muscle relaxers, and antiemetics may relax the child, but they do not necessarily relieve pain. So they're better as adjunct than as the only pain medication we're giving. When we're communicating with children, last piece of this, and then we're going to talk about immunizations. So when communicating with children, you need to keep in mind the developmental stage of the child. Communicate in ways directed at that developmental stage. You want to give the child time to warm up. Focus on the parent or a toy or a doll first. Pay attention to their nonverbal communication. Communicate through play, and use language that's appropriate to the child's development and understanding. So we don't want to go in and start explaining things to a 5-year-old as we would an adult. We want to go in and talk with them, maybe show some interest in a toy, share something interesting with them, let them play with a new toy, and then try to get an idea of what they understand about what's going on and give them information in ways that are meaningful to a 5-year-old. Okay, we have one more section in this unit, and that will be immunizations.